Welcome to Essentials of Pharmacology for Health Professions, 9th edition, Chapter 9, Administration by Peritoneal and Other Routes. Upon completion of this chapter, the learner should be able to name 4 administration routes with systemic effects, explain administration via the sublingual and buccal routes, including instructions to the patient, demonstrate application of transcutaneous medications, compare and contrast the advantages and disadvantages of the inhalation route, describe patient education for those receiving the inhalation therapy with handheld nebulizers, contrast small volume nebulizers, your metered dose inhalers, and dry powder inhalers. Also be able to identify the parts of a syringe and needle, and select the length and correct gauge needles for various types of injections. List the 3 types of syringes and their purposes. Demonstrate drawing up medication from a vial and an ampule. Describe an intradermal injection, subcutaneous injection. Also, we want you to be able to describe the 3 sites for intramuscular injection. Describe the intramuscular injection. Give the purpose and the demonstration of the Z-track injection. Discuss IV administration and various types of IV fluids that can be prescribed, and identify the 3 local routes of administration. Peritoneal routes include any route other than the oral route. It is defined as any means of injection that bypasses the skin and mucous membranes. Other routes that must be considered besides injectables are the skin, which is transdermal, mucous membranes, which is your sublingual and your buccal routes, your eyes and your ears, which is your otic and your optic routes, and then your respiratory route, or tract, which is your inhalation route. The chosen route of administration can be better understood if the purpose of administration or the desired effects are considered within the 2 categories, systemic and local effects. First, let's talk about the systemic effects, which affect the entire body with the goal of distributing the systemic medication through the circulatory system to the areas requiring treatment. Those routes are sublingual or buccal, transcutaneous, which is transdermal, inhalation, or injection. Now, our local effects are limited to only one part or location with very little, if any, effect on the rest of the body. Medications within this category include the topical medications that are applied to the skin for skin conditions, drugs that are applied to the mucous membranes to treat specific tissue, medications that are instilled in the eye for eye conditions, or medications that are instilled in the ear just for ear conditions. Okay, we're going to check our knowledge, which is not considered a systemic effect route. I want you to look at your choices and write down your answers. We'll check them at the end of the video. Okay, we're going to take a look at our sublingual administration and our buccal administration. Our sublingual is the medication that is placed under your tongue. It is more common than your buccal route. The medication is absorbed directly into your circulatory system. Instructions on giving it is to hold the tablet in place in the mouth with your mouth closed until it's absorbed. We do not swallow it, and we do not drink or eat anything for 15 minutes until the medication is absorbed, until you no longer feel it, okay, that you have nothing under your tongue. On the buccal administration, the medication is in a pouch and is placed between the cheek and the gum at the back of the mouth. The medication is unaffected by the stomach, intestines, or the liver. Since absorption is through this route is rapid, this method is used when a quick response is required, providing quick relief. Instructions are to hold the tablet in place with mouth closed until it is absorbed. Do not swallow the medication. Do not drink or eat 15 minutes until the medication is absorbed. Check your knowledge. When administering medication sublingually or buccal route, patients should not eat or drink within how many minutes? Look at your choices. Write your answer down. We're going to check it at the end of the video. We're going to talk about the transcutaneous drug delivery system along with the transdermal administration instructions. Your transcutaneous and transdermal systems both deliver medications to the body by absorbing through the skin. Your transcutaneous delivery system utilizes a patch that is impregnated with a particular medication. This is applied to the skin and left in place for continued absorption. Absorption by this method is slower, but the action is prolonged than with other medications or other methods of administration. The drug is released at a constant rate so that the concentration of the drug is kept at a certain level in the body. Now, our transdermal administration instructions is that if you're looking at the picture below demonstrates proper transdermal administration of nitroglycerin ointment. It is important to remove the previous patch carefully and discard of it appropriately. You want to make sure that nobody else can get access to it. The patient would then select a site for the new administration. Remember to rotate areas of placement. It is important to make sure the skin is clean, dry, and free of irritation. The patient would open the packet by pulling the two sides apart without touching the inside. It is then applied by placing the side containing the medication through the skin and pressing the adhesive edges down firmly all around the patch. After application, the patient should wash their hands immediately to prevent any burns. Certain patches must be removed prior to non-invasive procedures such as cardioversions or defibrillations. Now, with transdermal patches, there are, of course, nitroglycerin patch is for angina, but you also have patches that is for motion sickness. You can also get some to help with chronic pain. Those are some of the different ones that are done in patches. But also make sure that you read your patient education under this section, as it has 9 items. That's very important that you read it. Okay. We're going to check your knowledge right quick. When applying a transdermal patch, the patient should look at your choices. Write your answers down and check it at the end of the video. Okay, we're going to start with our inhalation route. These medications are frequently administered through inhalation, especially to those with chronic pulmonary conditions. There are various ways patients may self-administer inhaled medications such as a metered-dose inhaler, dry powder inhaler, or a small volume nebulizer. The advantages are rapid action of the drug, convenience and comfort for the patient. It minimizes side effects due to the smaller doses based on potency. The disadvantage includes improper administration, dependency for patients with asthma or chronic obstructive pulmonary disease, which is your COPD, a source of infection that is not if it's not properly cleaned, and adverse symptomatic side effects due to the extensive absorption capacity of the lungs. So we're going to start with our small volume nebulizer, which are utilized to deliver various medications in aerosol form to our patients. A nebulizer is powered by a gas source and a small air compressor in the home care setting. Proper breathing techniques must be used for optimal drug disposition in the lungs. In addition, it is imperative that proper cleaning be conducted of the nebulizer to ensure the safety and health of the patient. To ensure proper administration, patients should be instructed to inhale slowly and deeply, perform a short breath hold, and exhale slowly. Your side effects could be dizziness if you begin to hyperventilate. Our meter dose inhalers deliver a measured dose via a propellant within a canister. These devices are portable and easy to use. However, proper administration by the patient is essential for drug effectiveness. If needed, a spacer may be added to act as a reservoir for the aerosol, allowing the patient to first depress the canister and then inhale. There are safety measures on many spacers that provide a horn or whistle which signifies the patient is breathing too rapidly. So what you're looking at, if you'll notice, you see the canister of medication and the clear tube with the blue ends. That is your canister that holds the medication. So you release it in there and then the patient breathes it in. Okay, our dry powder inhalers are devices that deliver a drug in a powder form into the lungs with no propellant or external power source. The patient must generate a sufficient inspiratory flow rate for the powder to aerosolize properly. Therefore, dry powder inhalers are used for prophylactic treatment and not for acute breathing problems. The advantages include it's small and easy to carry, estimate time of inspiration technique. The disadvantages are fewer drugs are available in this form, and it generates a significant inspiratory effect for proper drug delivery. So those are your disadvantages. Our intermediate positive pressure breathing treatments, although it is not commonly used, may be ordered by the physician. Your IPPB combines administration of an aerosol with a mechanical breather to assist patients who are unable to take a deep breath on their own. Healthcare personnel, such as respiratory therapists or nurses, are specifically trained in the use of this equipment. Cautions with IPPB therapy include you have to monitor the vital signs closely, watching for a sudden drop in blood pressure, tachycardia, and decreased or shallow respirations. Observe for nausea or distended abdomen. Watch for tremors or dizziness. Assure the patient that's coughing after the treatment is to be expected. The goal of the treatment is to aid in coughing up the loosened secretions, and then record the effectiveness of the therapy and any side effects observed are reported by the patient. Check your knowledge. The advantages of the inhalation route include all of the following except. Your magic word is except. Look at your choices, write down your answers, and we'll check it at the end of the video. Okay? Check your knowledge. Which instruction is not included when providing guidance to patients on how to administer nebulizer treatments? There's your choices, write down your answers, and check it at the end of the video. Check your knowledge. The device used to act as a reservoir for the aerosol, which allows patients to first depress the canister and then inhale it, is called what? Look at your choices, write down your answers. We're going to check it at the end of the video. Okay, we're going to take a look at our parts of our syringes and our needles. So, in order to administer injection, it's important to be familiar with syringes and your needles. Most syringes are plastic and are disposed after each use. Some syringes utilized in procedures may be glass and are sterilized after use. So our syringe parts, if we're looking at it, our barrel, if you look at your picture inside the barrel, is the hollow cylinder that holds the medication. It contains the collaborations for measuring the quantity of medication. It is important to note that this part is not sterile. Okay? Your plunger is what goes on the inside, is the inner solid rod that fits snugly into the cylinder. Pulling back on the plunger allows solution to be drawn into the syringe. Pushing forward on the plunger ejects solution or air from the syringe. The inner portion of the plunger is sterile. The tip is the portion that holds the needle. Most tips have a system called a luer lock, which locks a needle in place. This tip is sterile. Okay, what we are looking at is our needle, and it has three parts. We have the hub, which is the flare end that fits on the tip of the syringe. This part is sterile. Your shaft is the long hollow tube embedded in the hub. Needles have shafts with different lengths. Various sizes for shoulder needles include a half, 3/8, and 5/8 inches. These are used for your intradermal or your subcutaneous injections. The gauge is the size of the lumen or hole through the needle or the diameter of the shaft. The gauge is numbered in reverse order, meaning the higher the number, the smaller the lumen. The size of the gauge is determined by the site of the injection and the viscosity of the solution, which basically the thickness. The shaft of the needle is also sterile. The tip is the pointed end with a bevel edge. The tip is also sterile. You see how it is not wrecked straight across. Okay, let's check our knowledge. Which part of the syringe is not sterile? Look at your choices, write down your answers, and we'll check it at the end of the video. Okay, our main types of syringes that are used for injections. There's 3 of them. Our standard syringe, which is the most frequently used for subcutaneous or intramuscular injection. It is collaborated or marked in your cubic centimeters or your milliliters. The most common size used is 3 milliliter or your 2.5 milliliter. The syringe that you're looking at is 3 milliliters, and you'll notice that its color, how much medication it has in there. Your tuberculous syringe, which is most frequently used for intradermal injections of very small amounts of a substance. This syringe is also used for subcutaneous injection when a small amount of medication is that needs to be given. It's only up to 1 milliliter, and you can look at that. Your insulin syringe is only used for insulin and is collaborated in units. The common size used today is U100, which is 100 units of insulin, which is equal to 1 milliliter. Okay, we're going to check your knowledge. Which needle length is generally used for intramuscular injection? Look at your choices, write down your answers, and you can check your answers at the end of the video. Okay, check your knowledge. Which of the following is an intradermal injection? Look at your choices, write down your answers, and we're going to check it at the end of the video. Okay, and we're going to draw up medication, whether it is through a vial or an ampule. There are 8 proper steps to drawing up medications. We need to always make sure we wash our hands. We need to assemble our equipment. That would be your syringe, your needle, alcohol wipes, and medication. You want to always check the order using the 7 rights of medication administration and scan the patient and medication in electronic medical administration, which is your MAST system. You rotate the vial's protective cap and wipe the rubber diaphragm with alcohol wipe. Check the vial for date and any discoloration. You set the needle securely on the syringe by pressing firmly downward on the top of the needle cover, pulling the needle cover straight off. You draw air into the syringe equal to the amount of solution you will be withdrawing from the vial. You insert the needle into the center of the rubber diaphragm and inject the air into the vial. Invert the vial and then withdraw the prescribed dosage. Be sure there are no bubbles present and then withdraw the needle. Recap the needle carefully, using only one hand to maintain sterility and to avoid any accidental needle stick. Hold the syringe in the dominant hand and carefully scoop up the cap without touching it. Do not contaminate the needle by touching it to the outside of the cap. If using a safety needle, you can recap, then discard and replace the needle with a new sterile needle to use for an injection. If the medication is in an ampule, hold the tip with an alcohol wipe to protect your fingers and to break open along the score marking at the neck. Tip the vial and withdraw the prescribed amount of medication. Recap the needle carefully, following the steps that were mentioned in step 7. Okay, we're going to check our knowledge. The following equipment should be prepped and completed prior to giving a patient an injection, except. Look at your choices, write down your answers. We'll check them at the end of the video. Intradermal injection instructions. Proper steps to prepare and give an intradermal injection. You need to wash your hands. You assemble your equipment, which is a TB syringe. It's 26 or 27 gauge, 3/8 of a needle, alcohol wipes, 2x2 gauze square, and the medication. You check the order using the 7 rights of medication administration and draw up the medication. If you're using an EMR system that's in place, scan the patient and the medication. You want to identify the patient and explain the procedure. The arm should be supported on a flat surface. Put on gloves. You want to cleanse the skin with an alcohol wipe on the inner surface of the forearm or other area if ordered by the physician. Allow the skin to dry thoroughly. Do not blow or fan the skin to assist drying because this can foster infection. If you inject before the skin is dry, you might introduce alcohol into the skin and interfere with any test results that you may be performing. Avoid areas with hair or blemishes. You want to hold the patient's arm in your non-dominant hand and stretch the skin tongue. Hold the syringe so that the bevel is up and the needle is almost flat against the patient's arm. Slowly insert the needle only far enough to cover the lumina or opening in the needle. The point of the needle should be visible through the skin. If you look at the picture that I have provided for you, that is exactly how you would go in. 10 to 15 degrees. Barely. Okay, we inject the medication very slowly. You should see a small white bubble in the skin forming immediately. As you can see on the picture, if no bubble forms, withdraw the needle slightly. It may be too deep. If the solution leaks out as you inject, the needle is not deep enough. After the correct amount of medication, which is 0.1 to 0.2 milliliters, is injected, withdraw the needle. Do not massage the area. Or you may interfere with the test results. You want to discard the syringe with needle uncapped into the sharps container immediately without touching the needle. Then you remove your gloves, wash your hands. You want to make sure you write down the drug name, the dosage, date, time, and the site of the injection on the patient's chart. Instruct the patient not to rub, scratch, or rub the area. Provide written instructions regarding the time to return for reading. Tell the patient to contact the physician immediately or report to an emergency facility if they experience breathing difficulty, hives, or a rash. Check your knowledge. When given an intradermal injection, the proper angle of the needle should be what degrees? Look at your choices. Write down your answers. We'll check them at the end of the video. We're going to take a look at the subcutaneous injection instructions. We want to wash our hands. We'll assemble the equipment, correct size, syringe and needle, alcohol wipes 2x2 gauze ware, and the medication, of course. You're going to check your order with the 7 rights of medication administration and draw out the medication. If you're using an EMR system that's in place, scan the patient and the medication. You want to identify the patient, ask the patient's name. You want to check their armband, and you want to explain the procedure. Use an alternate method to identify the patient if it is necessary. If the patient is receiving frequent injections, be sure to rotate the injection site. Put on gloves. Cleanse the skin with alcohol wipes. You want to pinch the skin into a fat fold of at least 1 inch. Insert the needle at 45 to 90 degree angle depending on the amount of substance tissue available. The leaner the patient, the closer to 45 degrees. Your subcutaneous injections are administered into the fatty tissues of the upper arm, front of the thigh, abdomen, and upper back. If you'll look at the figure 917, a 2.5 to 3 milliliter syringe is usually used with a 24 to 26 gauge, 3.5 to 5.5 inch needle. No more than 2 milliliters of medication may be administered subcutaneously. As I previously stated, there's a picture for you to see how you would pull that. You inject the medication slowly, pushing the plunger all the way. An injection that is too rapid may cause pain. Place a dry 2x2 gauze over the entire site, applying pressure with it as you withdraw the medication rapidly. Do not push down on the needle while withdrawing it. Do not massage the injection site. Discard the syringe with needle uncapped into the sharps container immediately. You want to remove your gloves. Wash your hands. Note the medication, dosage, time, date, and site of injection, and your signature on the patient's record. Observe the patient for effects and record observations. Sometimes you'll have to watch the patients for at least 20 to 30 minutes after they've had an injection. We're going to check your knowledge. When given a subcutaneous injection, the proper angle of the needle should be. Look at your choices, write down your answers, and we'll check them at the end of the video. We're going to take a look at the sites for intramuscular injection. We have 3 locations. The first is your ventrogluteal site. This site can be used for all patients, and the patient that is positioned on their side or their back gives you, if you'll look at the picture, which is above and to the outside of the buttock area on the hip. You'll see where you talk about the greater trochanter, your anterior superior iliac spine, and then where you go in from there. Your deltoid site, this site is recommended for vaccine for adults and may be used in children between the ages of 1 and 18 for vaccines. That would be your upper outer arm above the axilla. If you look, you measure where the acromial process comes down and make a C, and then in that C is where you are going to give your injection. Okay. Our third area is our vastus lateralis. This site is located on the anterior lateral thigh and used for vaccination for infants, and these muscles are the most developed for children under 3 years of age. Front of the thigh towards the outside of the leg. If you're looking at the picture, that's the area that you're going to go. The intramuscular route has two advantages over the subcutaneous route, and that is a large amount of solution can be administered, up to 3 milliliters or a maximum of 1 milliliter in children. Absorption is more rapid because the muscle tissue is more vascular, which meaning it contains many blood vessels. Okay, so we are going to discuss the proper techniques for intramuscular injection. And of course, wash your hands. We're going to assemble our equipment, correct size syringe, needle, alcohol wipes, 2x2 gauze square, medication, and then our EMAR system, which if it's in place, we scan the patient and the medication. We check the order with the 7 rights of medication administration, and we're going to draw up the medication or insert the appropriate pre-fill cartridge into the cartridge holder. After measuring the correct amount of medication in the syringe, we draw 0.2 milliliters of air into the syringe to clear the needle. You want to identify your patient, ask the patient's name and check their armband and explain the procedure. And if we need to, we use an alternate method to identify our patient if it's necessary. If the patient is receiving frequent injection, we need to make sure that we always double check, but rotate those sides. We want to put on gloves. We want to position the patient and expose only the area to be used for an injection. We cleanse the skin with an alcohol wipe. With your non-dominant hand, you're going to stretch the skin taut at the injection site. Insert the needle at a 90-degree angle with a quick dart-like motion of your dominant hand. Okay, we're going to inject the medication at a slow, even rate. We're going to withdraw the needle rapidly, holding a dry gauze 2x2 over the site. If you look at the picture, it gives you an idea of how to give it. Apply pressure and massage the area gently with an alcohol wipe or gauze. You want to discard the syringe with the needle uncapped into the sharps container immediately. Discard your gloves and wash your hands. You want to document the medication, the dosage, the time, the date, the site of the injection, and you're going to sign off on that patient's chart. You watch for any side effects and any observation and record that. The needle must be long enough to go through the subcutaneous tissue into the muscle. The length of the needle varies with the size of the patient. It's not one size fits all. Okay? With a child or a very thin, emaciated adult, a 1-inch needle is usually adequate. For most adults, a 1.5 needle is appropriate. However, for an obese person, a 2-inch needle might be required. The needle is inserted at a 90-degree angle with the skin spread taut. Look at the picture, okay? Thank you. Alright, our Z-track injections. So, our Z-track injections are recommended for intramuscular injections that may cause irritation to tissue such as your iron dextrin, hydroxyzine, or your sulfazoline. Proper techniques for drawing and administer a Z-track injection are drop the medication and then add 0.3 to 0.5 milliliters of air to the syringe. Then replace the needle with a sterile one that is 2 to 3 inches long. You want to stretch the skin as far as you can to the outer side and hold it there. After cleansing the site, insert the needle with a dart-like motion and then inject the medication slowly. Wait 10 seconds before withdrawing the needle. Withdraw the needle and allow the skin to return to normal position. This seals off the needle track. Press firmly on injection site with a 2x2 gauze square. Do not massage the site because this could spread the medication to the subcutaneous tissue, causing irritation. Advise the patient that walking will aid absorption and to avoid tight-fitting garments that cause pressure on the site. So you look at A is where you're pulling it, B is where you inject, and see once you withdraw the needle, how the track, so it will not sift up. Alright, so we're going to check your knowledge. Which injection site is mostly used for administration of vaccination in an infant? Look at your choices, write down your answers, and we'll check it at the end of the video. Check your knowledge. What is the proper amount of air to withdraw into a syringe to place in the vial for an intramuscular injection? Look at your choices, write down your answers, and you can check it at the end of the video. Check your knowledge. Which would be the purpose for administering a Z-track injection? Let's look at your choices, write down your answers. You can check it at the end of the video. IV administration and prescribed IV fluids. There are two types of IV administration. The first one is continuous IV infusion. Your second one is the intermediate IV infusion, which is like your piggyback or a bolus. Both IV administration require similar equipment, which includes an IV catheter that is inserted into the vein, a bag of IV fluid, and a small bag of medicine, which is considered to be piggyback. And then your medication in a syringe. Generally, your physician, your RN, your LPNs is responsible for administering IV medications. Now, your continuous IV infusion is administered slowly over a long period of time. The IV solution may or may not contain added medication prescribed by the physician. This medication is hung from an IV pole and is typically infused via an infusion pump at a prescribed rate. There are three types of solution based on the effect they will have on your cell. Your isotonic is cells remain the same. Your hypotonic cells swell. And then your hyper is cells shrink. Now, if you look at the table 9.1 that is in your ebook, it goes a little bit more detail for your types of IV fluids. Your intermediate IV infusion is also known as a piggyback, which is a term used for medication mixed in an additional bag that contains a small amount of IV fluid that is administered over a short period of time at a prescribed interval. Most often, antibiotics are administered through an infusion pump. An IV bolus / push is when a medication is not diluted on an IV fluid, which is injected directly into the IV catheter. Your local routes of IV administration. The IV route involves injecting liquids into the vein. The therapeutic effect of this route is immediate. The IV route is used for the following: administer medication, correct your body imbalances, like if you're dehydrated, correct your electrolyte imbalances and your low potassium, provide some nutritional support for patients who are NPO for a short amount of time, and then administer blood or blood products. Check your knowledge, which is not an example of an IV solution that is utilized in a continuous IV infusion. Look at your choices, pause the video, and write down your answer. Alright, so we're just talking about medications in general. We've got skin medications. Your topical medications for the skin are prescribed for a great variety of conditions and are available in a variety of forms. You have ointments, lotions, creams, solutions, soaps, and baths. Administration of topical medications requires knowledge of the condition being treated and the purpose for that treatment, and to the strict adherence of directions as prescribed by the physician or provided by the pharmacist, or to the instructions of the medication container or the package insert. When in doubt regarding administration techniques, always ask a qualified person for advice. Now, eye medications, make sure to read the technique of installation. And then your ear medications, make sure you also read the technique of installation. Check your knowledge, which is not a reason for a patient to receive an IV treatment. Look at your choices, write down your answers, check them at the end of the video. Self-assessment. Here are 3 questions that you can ask yourself. What can you do to assist in memorizing the different forms of injection types? How can you practice preparing and administering the various types of injections? As a healthcare professional, what can you do to ensure the safety of patients who may receive injections or IV treatment? Make sure to check your answers on the knowledge check activities.